Good afternoon, my name is Dr. Mason Harris. Today we're going to be demonstrating and explaining monofilament trigger point dry needling. So today we have our patient down here. We're always going to make sure we sanitize the areas before we apply this treatment into small insertions into the body. We can use this for multiple different reasons. We want to release tissue or those stubborn little myofascial adhesions or trigger points, those knots, those clinical knots. We can apply a needle into the surface and get the muscle to relax. We stimulate blood flow into those regions. So we're going to be demonstrating that today. Ensure that everything is sterilized into the insertions where we're going to be putting these needles. We use imaging studies to make sure that we know the density of the patient's muscle tissue where we're going to be doing the insertions. Today we're going to be working in the upper trap muscle on her right side, the trapezius. We have stubborn trigger points that get caught into these areas when we're working at computers and the stress of 2026. Open line of communication with the patient is important. Make sure they're comfortable. Make sure that you tell them, please be as still as we can. They're sneezing or coughing and things like that. The first insertion, you ready, patient? First insertion is going to be performed here. We palpate and find that trigger point, and we slowly insert that needle into the trapezius muscle. Now, what we can do when we're trying to loosen this tissue is piston and twist the needle through the trigger point. We can twist, we can hold it there, we can piston, and help get blood flow and blood perfusion to these areas.